Hospice made it possible for me to keep him at home. We slept together in the same bed, just like we had for 60 years. COVID came, and that meant that he was here with me and I was caring for him. And the evening he died in my arms with my telling him how much I loved him and how glad I was I married him. That was a blessing that I thank Hospice for, because they made it possible for me to do that. The biggest thing I think about Hospice is the people. And the thing that probably is most outstanding to me is that everyone always had time. I never had the sense that anybody was rushed when they came to us. The kind of support, the kind of encouragement, knowing that no matter what time of day or night it was, there was somebody that you could call if you needed someone. That's a tremendous reassurance. You have no idea when things are getting rough and you don't know how to handle them, that there's someone you can always call. I think his quality of life was great up until the very end. He had a day he was unresponsive, and then that Sunday morning, we knew it was getting close. And the people who came to support me and walk me through that was just amazing.
I really did appreciate the respite. That was a big help to me, beyond words. That is a wonderful thing that they have for people, to have a little break. That's so important because you get burned out. I realized shortly after being involved with hospice that it wasn't just for the patient. They were a big help to me, not just physically, but emotionally and spiritually. The social worker, who was wonderful, she would come and talk with me, and I knew she was checking me out to see, am I emotional stable through all this, or where I needed help. And she was great about it, and she would also talk with my husband. I miss him. But I'm grateful that he's not suffering anymore. I'm grateful that I was able to have hospice to help me through all the different stages that he went through. Every stage they explained it to me, what is next. Even taught me, just by watching them, what to do, what to say, how to cope. I would have been lost without hospice.
Hospice of the Valley provides care to patients wherever they call home. That could be a traditional home, that could be a nursing home, it could be an assisted living, group home, and we also provide care here at our inpatient facility, the Hospice House. We provide a couple different levels of care. There are times patients come here for what we call general inpatient, meaning that their symptoms are uncontrolled, and they come here. Our goal really is to get their symptoms managed and get them back to whatever environment they prefer to be in. We also provide what we call respite care here. It's part of the Medicare benefit, and it allows individuals under hospice care to come here for 5 days to give their family relief, rest, break sometimes. The Hospice House has 16 patient rooms. We also have a family kitchen. The families have the opportunity to be able to bring in food, make meals if they choose to. We do have a chapel. It's non-denominational. It's a place for families to go and just maybe have some time of relaxation. We have a children's play area, and we also have a playground outside for children. We provide a variety of services, whether it be support groups, one-on-ones, memorial services. That's all free of charge, and it is also available to community members as well. Hospice of the Valley does provide comprehensive care. We provide services of nursing. We have a full-time medical director, volunteers, social workers, chaplains, our personal care team, and our bereavement staff. Dying is not necessarily just physical, it's emotional, it's spiritual. So our hope is that we can meet the needs of our patients and our families in every way possible.
It's almost like as if hospice gathered up all the most wonderful people in the valley and caused them to work for them, because it's like one person was nicer than the next. really good people, really compassionate, caring. Can't brag on them enough, really.
The people is what makes hospice so special. We used to say, you don't apply to work for hospice, you are called. And I really think that's true because the people who work for hospice have a special kind of gift. And they shared that gift with us.